Hello, everyone out there in Dinkland. It is Hump Day. Time for Hump Day Happy Hour with Dentists in the Know. This is your backstage pass for current trends, politics, and education in the dental world. It's live, and it's over a cocktail, and we've got some great conversation tonight. Our guest is coming to us from Mexico City, and this episode is sponsored by Spear Education, which we are so excited to have as an educational partner. As you all know, I am joined by two of my best friends in the world. They also happen to be dentists. They also happen to be business owners, and they also happen to be educators. The three of us together are the Dentists in the Know. They are Dr. Jennifer Bell and Dr. Chad Duplantis. I am Dr. Jeff Horowitz. We welcome you all this Hump Day Happy Hour.
Hey, Dinks. Well, I had to record the news on my own tonight because we had such a phenomenal guest from Spirit Education, Dr. Ricardo Mitrani, that we ran out of time and didn't get to the news. So we didn't want to leave you without a little news to head into the weekend. So with that, this is the news. It's been an interesting turn of events over the last few days. I'd say over the last 7 days. We're seeing a huge uptick in government agencies wanting to move forward with some type of extension of dental benefits in the various realm of government and supported benefits throughout the U.S. So November 15th, we saw a communication come out about wanting to include dental health benefits for ACA for those who are receiving their benefits on the exchange. And then just this week, we saw another notice come out from the federal government about wanting to increase the opportunity for non-pediatric benefit in Medicaid. So we know there's been a lot of movement in the Medicare arena for dental benefits to be covered. Now we're seeing a push for ACA to offer dental benefit as well as Medicaid. And if the federal government changes some of these regulatory issues and opens up additional funding for states to take advantage, it doesn't mean states are required then to add dental benefit for non-pediatric patients in their Medicaid programs. But if there's increased federal funding, we would expect that you would see an uptick in non-pediatric dental benefit being offered by the states. Some states currently do offer adult benefit, but not all. And so we're seeing some movement. I just find it really interesting that there's multiple open comment periods have come up now, trying to push forward with dental benefits in several different areas of government mandated, government controlled insurance. So again, that is trying to increase or provide dental benefit in on the exchange, and then also in Medicaid programs that are being offered within the states. So we'll see. Open comment periods for each are within the early first week of January. So if you have this is a passion project and want to communicate your feelings about whether or not dental benefits should be included in the ACA and or increasing non-pediatric benefit in Medicaid on a state basis, then you certainly should take advantage of the open comment period that is available through January 9th and January 2nd, respectively, for each program. You can do a search on ADA's website or in drbicuspid.com, who both notified different entities about these changes that could potentially be coming up. Another interesting story that came out this week, it didn't bring a lot of heartwarming feelings for me. It was a projection of income for a lot of professions over the next 10 years, looking at 2033. While most saw an overall increase in income, the increase in income related to the normal inflation rate, which the normal inflation rate in this particular study was 2.17, which we're currently seeing far in excess of that, dentists will experience actually a decrease in their overall hourly rate by $13.72. So while you may still be making slightly more money than you're making today, the value of that dollar will be worth less. Therefore, how far your money will go will not be increasing. I really want to see additional information from this study about whether or not support staff and personnel for the dental office will continue to go up, because that will be a really interesting kind of correlation. If dental hygienists, dental assistants, and front desk staff will continue to see increases overall, even against inflationary adjustment over the next 10 years, and dentists see nothing but decreases against inflationary adjustment over the next 10 years, the mental health of dentists working harder for less money may start to become a more significant issue, honestly, than it already currently is today. And with that, that's the news.
I will go ahead and introduce our guest. Our guest tonight is Dr. Ricardo Mitrani. And I just want to call him Ricky Ricardo because that's one of my favorite things to call people is, Ricky Ricardo from the Lucille Ball Show. But he's authored many scientific articles and chapters and textbooks on implant, prosthodontics, and aesthetic dentistry. He's given more than 500 lectures in 30 countries. He maintains a private practice in Mexico City limited to prosthodontics and implants. He serves as an instructor in Spear seminars, and that's been since 2016. He's been a resident faculty member at Spear. He frequently contributes to Spear Digest, develops numerous lessons for Spear Online, and Dr. Mitrani has authored many scientific articles and chapters and textbooks on implant prosthodontics and aesthetic dentistry, and has given more than 500 lectures in 30 countries. But beyond that, he's been happily married for 29 years to his wife, Sandra, and they have 3 amazing children. He loves music. He's a world traveler, and he is a perpetual student. And I have seen this guy speak, and he is the real deal. So it's a real honor to have Dr. Mitrani with us. So thank you so much for being here.
Oh, thank you, guys.
Welcome.
Thank you. Thank you. What a pleasure to hang out with all 3 of you.
Well, I got to lead off with this. So Dr. Mitrani, in our little intro that we do before the show, first of all, I'm already a fan just because of what I've heard about you. I've not seen you lecture in person yet, but I've only heard amazing things. So we're excited to have you, and can't wait for you to share about some of the things that you're teaching with Spear Education. But honestly, right now I am a little star-stricken because HIPAA prevents me from saying who this person is. But Dr. Mitrani actually shared with us that one of his patients played a very major role in one of my favorite series called Narcos. And so I won't even share the character name, but boy, I'm a little. He was a badass.
He was a badass, wasn't he?
Yeah, he was a badass. Yeah.
And apparently a very, very nice guy. But he was kind of a nice guy in the series too. Like, he was a badass that was also a nice guy to the people that were good to him.
But you know what, Jeff? Every time he was on the screen, I had a problem with his teeth. There was something there. I was like, I'm not sure what it is, but I gotta know.
Like, who is this guy's dentist?
Yeah.
He hasn't been around. He hasn't been around in a while, guys. In all fairness.
I kid. Yeah.
All right. Well, Dr. Mitrani, why don't you, because coming from Mexico City, why don't you tell everyone out there about your background, about what got you interested in dentistry, and then maybe a little bit about your path to where you are now in Spear Education.
Sure. So, I grew up in a family that was pretty much health science oriented. My dad was an immunologist. I have an older brother who's a dentist, another brother who's a physician, and it was kind of like sort of in the genes, I guess. It's something like I didn't think too much about. And one of the things that happens in countries like Mexico or Europe is that, as opposed to the US, we basically need to choose what we want to do right after high school. And so we don't spend the 4 years in college that are so enlightening to sort of see where you want to go. And so to me, it was like a family influence, if you will, that got me into dentistry, but without really knowing what being a dentist was. And the reality is, even if you have those 4 years of college, I would ask all three of you, I mean, do we really know what being a dentist is? I mean, we really don't we? And so it's like a gamble, it's like a flip of a coin. And so I mean, I finished dental school, and then I worked with my brother for a few years, and as a GP. And one day I just felt like I needed to go back to school. I needed to learn some more. And so I applied to a bunch of schools. I wanted to be a prosthodontist. I applied to a bunch of schools, and for the love of God, I still don't know why, but they took me at the University of Washington. And I say this because it's a pretty astringent program to get into. I mean, back in the day, you'd had like close to 100 applicants for 3 slots. So it was like really, really challenging.
And I don't know any big names that have come out of UW. Do you?
Hardly any. Hardly any.
If only.
So yeah, it was a pretty humbling experience, pretty intimidating experience, because just think about this. There was like a 3-day deal of interviewing and selection process. You had to write a 150 question exam, which I had no idea I was going to do that. And ultimately, I found out it was a portion of the pros board exam. So what would you know about? One of those exams that you write the exam, and the only certainty is that you got your name right. Otherwise, it was like, seriously, I was like kind of guessing. Then there was a wax up exam. You had to wax up a 3-unit bridge, both anterior and posterior. Then you had to go through a treatment planning exercise. They gave you a bunch of x-rays and casts, and you had to treatment plan a whole mouth. And then in the end, there was like an interview. It was like a very, very intimidating interview with like 5 poker players sitting across the table, kind of like asking you, why should we take you? So, it was...
I'd have been out at the wax up. Sorry to interrupt, but I'd have been, I'm out.
Well, the second I'll tell you this much, Jeff, the second I heard about the process, I called my wife and I said, you know what, sweetie, I mean, I'm in this part of the world. I might as well spend some days here. I've heard that Vancouver's amazing. I'm going to go visit because there's no way in hell they'll take me here. I was that sure that it was like a very, very tough deal to get in. And I really got really, really lucky. I know that I really sucked at writing that exam. The wax up I sort of did okay. But they really took me because I guess they believed in me during that interview,
It all just clicked as you're telling this story as to why I know you beyond the lectures that I've seen you on.
Okay.
We sat together. I believe it was 2 years ago at the AARD meeting. Were you there in Chicago?
Of course, every year.
And it was you and I, and Tal was at our table.
Okay, sure.
And you all were arguing in Spanish.
Okay.
Over something stupid. And I understood everything that you all were saying. And so I got to practice Spanish with you guys. And we had a hilarious conversation, but it was a very nerdy argument. And it cracked me up because I love Tal, but he'll argue with a fence post if they'll let him, But I love the guy, so it all just clicked with me, and now it all makes sense as to why I liked you, because you actually stood up to him. So kudos to you, Ricardo.
Well, we always have fun giving Tal some shit, so it's
yeah. That's great. So I'm assuming that's where your connection to Greg and Frank came was through Washington?
Absolutely. So Greg was 1 year ahead of me.
Okay.
Can only imagine having Greg Kinzer as your senior classmate, the guy that had like the perfect, I mean, his work has always been impeccable since day one. I mean, he graduated from the UW undergrad, right? Mm-hmm. And they basically just picked him. I mean, they persuaded him to do pros. He wasn't even going to do pros.
Yeah, he wanted ortho.
Yeah, ortho. Right. So just imagine walking into that lab and seeing, the Iñaki Gambarinas, Tal Moore, Greg Kinzer, all these like amazing folks. I mean, I had a classmate, Jacopo Castelnuovo from Rome. It was like a very international program, which made it really, really cool. We had people from Japan, from Russia, from India, from Taiwan, from Spain, you name it. Actually, come to think about it, I think Greg was the only American grad student in that era. You know,
Wow.
three students per year. And that's kind of like the way that Ralph Udalitz, who was the guy that put the program together, kind of like envisioned it, you know, to have a truly international mix of grad students. So it was amazing because, as I said, we had people from all over. And it was fun learning from other cultures, you know, going to my friend's Yoshi's house for dinner, you know, him being Japanese and really being able to understand the Japanese culture with a classmate from Japan or from France or from Italy or from Mexico in my case. So it was very enlightening because it really gives you a sense of, you know, how people live elsewhere. And it's really, really cool. It complements your education. You know, the one thing we had in common was, of course, being dentists and doing pros. And as you know, that program was really, really rough to go through. So it was life-changing. And then, of course, Greg joined Frank in practice. And again, Frank chose Greg. Greg had to be the chosen guy because he was like perfect. And they did really good initially. And then, of course, Frank moved to, he partnered with Imtiaz Manji at the Spear Center in Arizona. Then Greg started also teaching there, here and there. And then Spear has a yearly summit. And in 2014, through Greg's persuasion, they invited me to lecture at the summit. And by the way, if you guys haven't been to the Spear Summit, I would love to host you, to have you come and check it out. It's a heck of a meeting. I mean, you mentioned, Chad, the Restorative Academy, which is, of course, one of the premier academies in the world. And I bet all three of you have been to great meetings, but our summit is really, really special. Anyway, so they had me come and lecture at 2014. Back in that time, I was like traveling around like a chicken without a head all over the place. And, you know, I went to Spear. I was like blown away with what I saw. And luckily, they asked me to come back. And then they offered me a position as a resident faculty. And it was, again, yet another absolute life changer experience for me.
So I'm going to take a detour off of our topic for a second, because I think this is pretty profound, because I have a pretty good idea of the way that you were trained.
Mm-hmm.
But do you see all of the digital influences that are in practice today for treatment planning to replace wax ups and whatnot? Mm-hmm. Do you see that as hugely beneficial, or do you struggle with it based upon the way that you were trained? Because I know that there's some differing opinions out there, but
Mm-hmm.
you know, I think the younger dentists see it as truly beneficial, but a lot of them didn't even do it the ways that the four of us were trained, because we were all trained with wax, you know?
Such a great question, Chad. And, you know, I would answer this way. Depending on what type of technology, we may be more of a like an earlier adapter, or we may be more of a slugger, you know? Mm-hmm. I'll give you one example that clearly exemplifies where I was 20 plus years ago. So back in the day when we trained in Washington, we were taking pictures with analogic photography, which meant that we would have to take pictures, develop the rolls, you know, go to a place to have the slides developed, then come back, look at them, and put our presentations together. We were actually giving presentations with slide carousels.
Yep, I remember that.
As long as you didn't drop them off at Photomat, you're okay.
Yeah. Totally. So imagine having Frank Spear, John Coyce, Vince Kokich as your mentors. I mean, putting those exquisite presentations with slides. So the one thing that we had to learn day one was to do great photography. Because back in the day, as I said, if you didn't take good pictures, and you couldn't even validate that the pictures looked good until you had the roll come back from the developing process, you know, and if you'd go through a surgical procedure like implant placement, and you screwed up your documentation, you were done. Like today we have digital photography, right? So, but the bottom line is, when we started doing PowerPoint presentations, it took me a while to adapt. I just couldn't give up my slide presentations, because to me it was like the true representation of what dentistry was. I did not, adulterate, or I did not do anything. It was the slide just as I took it, boom, put it in the carousel, present it, right? And I started seeing how people were like doing incredible multimedia presentations. And for a couple of years, I did not bite that bullet. I started lecturing heavily back in the day, and it would take me, and I have pictures I'd love to show you one day. I have a picture in the bed in my hotel somewhere in Spain, and I had 32 carousels with slides. That was a full day's worth. Okay. It was, or 24, because it was triple projection. So the amount of, it was like 1 hour per triple projection. So it was just a pain, to load and unload those carousels. So it took me a while to say enough of this, scan all those slides and go digital. Okay. This is back in 2002, 3 maybe. I'm going to fast forward now to your question, scanning, digital designing and whatnot. Today, I embrace the digital realm of dentistry as a blessing and something that we have to be as earlier adapters as we possibly can. Why? Because through digital, I mean, the whole premise of digital is being more predictable, or as predictable, and saving time. So it's just a matter of, again, biting the bullet and going through the learning curve and saying, okay, I'm going to start working on this technology until I'm good at it. And what happens to me here in my practice, and we have a group practice, I don't know about you guys, but I'm surrounded by millennials. And I have incredible young dentists and assistants that work here. I'm the oldest guy. I'm 56. And so now these guys mentor me, and I got to get as proficient as I possibly can with technology. So going back to your question, I think technology is here to stay. I think we got to bite the bullet and dive into it. I mean, of course, there are some clinicians that don't need to, because they have very comfortable setups in their quote unquote analogic realm, if you will. But I think it does make sense to be digital as fast and as the faster you bite the bullet and you dive into the digital, the faster you go into the learning curve, and you think digitally, because that's ultimately.
So Ricardo, I've got 2 questions for you based on that, because I'm in your generation, although it will make you feel good you're not the oldest person on this broadcast. I actually get that award. My point is that even if we fully embrace digital, and I try so hard to think digitally, there are still times where my articulation, there's no way to make that happen now, where I can get a case digitally articulated and do something that is right now. So working a lot in TMD and bite rehabilitation, for me, I want to get people started as quickly as I can. So very often it's a digital model, and then we 3D print that. And now I have a plastic set of models, but I want to give them something today. I want to get them something today. And so I will actually, and I don't use wax anymore, because I hate wax. I never liked wax. I embraced a product called Rivatech. And by the way, GC is not in any way sponsoring this, but it's basically a Tootsie Roll of composite. And I will bond to my plastic models, and I'm good with composite. I know how to work with composite. and I can do a full arch wax up in 10 minutes. I mean, if I need to, where I can polish it. And so I can work on, I can get it mounted in my office. I can articulate it perfectly, do my composite wax up, and then give the patient some kind of temporary that day. Do you think, my question is this, do you think that students and everyone who thinks strictly digitally needs to really understand the analog of what we do so that they can get out of a bind at the very least, if not be able to expand the number of services that they can provide? As a prosthodontist, I mean, you've done everything analog and right there on the spot. But I think that's becoming a lost art. And I worry about that, because when we go, like if we go to all digital dentures, we can't set teeth and process that overnight in a digital world. That can't happen. What we can do is reset the teeth and process it in the lab and have it the next morning. For the average dentist, that just can't happen digitally. And in some cases, analog can actually speed things up. Long question, I'm sorry, but
no, I think you frame it nicely. And here's the deal. I think dentistry should not be seen as neither analog nor digital. It's more like a cognitive process, and it's more like a process in which, I mean, at the end of the day, the dentistry is done manually, right? And so you can have all the technology that you want by your side, but let's say you have a patient that comes in and for whatever reason, your sophisticated technology is not working. And now you have to do a block carve provisional, unit provisional, just for the sake of discussion. You know, your hands need to respond. You need to understand tooth form. You need to have some understanding of occlusion. You have some understanding of contouring, of carving, of polishing. And so all these procedures, you got to understand them. Whether you end up, with some utilizing any whatever analogic or digital tool to enhance the process, it's fine. To me, the concern is, and I'll give you another example. If you're going to go through guided surgery for implants, those amazing opportunities and tools to do impeccable implant surgery, which we do here every day, should not disregard or should not negate the need to understand how to do surgery that is not as sophisticatedly guided. In other words, the challenge of contemporary young clinicians that didn't have that, so like at least a little bit of the last lag of training in the analog world, I think are losing a big chunk. And I think it's our responsibility in our generation, and probably JB is the youngest of us, and maybe she didn't have too much of an analog background, but I think our responsibility is to at least understand concepts, because at the end of the day, it's a conceptual thing. How do you bring something from point A to point B? Because, I mean, if we fast track 10 years from now, think about what technology will offer, the way that we do things. And I completely follow your protocol. We digitally design, then we 3D print, then we still get some silicone matrices. We do, mock-ups conventionally. I mean, and we're there like tweaking our workflows, which become like hybrid workflows in which we are bringing some stuff from digital, but we're still relying at some level to do some procedures also from the analog world. But this has nothing to do with the way we'll practice 10 years from now.
It breaks my heart, because we were taught, you nailed exactly what I was thinking, is that I always say when I'm lecturing that you have to understand analog in order to excel in digital. And the sad part is there's a dental school that I know that just opened up in Texas. And as far as impressioning is concerned, it's all digital. It's all digital. There's no analog. And that just really hurts me. And so what I'm saying and what I'm preaching and what I believe, I may not be able to preach 10 years from now because the analog may be gone in academia. But I'd also say, and I know you as a prosthodontist can relate to this, there is nothing better than holding a gorgeous wax up with that gray wax that's perfectly designed and just perfectly articulated. But that lab technician is probably also going to be the absolute best in the digital arena because they understand the concepts and the fundamentals.
We love scanning. We still do like full arch on implants. We're going to do like conventional impressions here.
I am too. Absolutely.
Yeah, I mean, how do you now border mold a distal extension? I mean, I still haven't figured out how to capture that digitally or a complete denture. And, you know, where I practice is not a very affluent area. I mean, I practice in a very median income area. And so we do a lot of, you know, 4 implant or 2 implant overdentures.
Sure.
And to us, you know, the fit of the denture and the border molding is still really important. And I've just not figured out a way to capture that digitally the way that I can with proper border molding.
You know, we're getting there. You know, I teach with Darren Deester, who's a phenomenal prosthodontist, also from Spear. We do a 2-day seminar on treating the terminal dentition and the fully edentulous patient. And Darren does a beautiful section on digital dentures. I think we're getting there. You know, little by little, Jeff. I mean, but again, we have to bite the bullet and you know, be willing to go into that. You know, it's called learning curve. It always bothers me that it's called a learning curve because I don't think it's a curve. I don't think it never plateaus. I think it's always a learning line. You know, it's an ascendant line. We just
the learning dip is what I.
Yeah.
Well, and the one thing that we haven't mentioned is that there are plenty of days where the technology fails you, and it's not because the technology in and of itself doesn't work. Because, you know, to your point, we are fastly moving into digital dentures and other things, but there are definitely days where I have every intention to do a same-day delivery of a crown, and then my milling machine craps out, or, you know, my Wi-Fi connection or internet goes down and I can't communicate with my scanner to my milling machine anymore, or whatever those nuances are. And so for young providers, the analog technique may be the only thing that gets you out of technology failures that will happen. And so it is vitally important that you understand how to negotiate both scenarios. There's your ideal that you would like to achieve, but technology is somewhat unpredictable on any given day. And we have to at least understand some way to close a case and walk away.
And you know what, Jennifer, I cannot agree more with you. And I would just add another piece on top of it, which has to do with, we often get too excited about our technology. We fail to connect with our patients.
Yeah.
I'll give you an example of a patient who was just here today and yesterday. This is a lady that desperately was looking for a second opinion. She came in with full mouth of provisionals, you know, very deficient preps and over contoured provisionals that were like all over the place. You know, the most swollen soft tissues you could think of. So how fast do you get from that to get her to believe in you? When this poor lady, you know, she's been through I don't know how many dentists, and now her whole mouth is on provisionals. So I told my staff, listen, with her, there's no better thing to do than for her to see us working with our hands in her existing provisionals. So, you know, said, Mrs. Jones, we're not going to hurt you. Trust us. I took her provisionals. I sat on the lab bench and I started carving those over contoured provisionals. The reason why we can do that is because we understand tooth form, tooth anatomy. We understand occlusion. We understand, arrangement, position. These are the type of things that, irrespective of how you train, you got to know all these things. Because as JB says, if for whatever reason, either A, technology fails you, or B, you have a situation like that, like the one I just described, you need to prove what you're made out of in front of your patient. And when the patient sees that at the end of the day, you're putting your hands in their mouths, you're talking to them, you're kind of like taking the pulse to see how are they holding up emotionally, cognitively, behaviorally. We don't do that because we're too impressed or too distracted by looking at our monitors or looking at our scanners and not really paying attention to our patients. We end up doing a huge disservice to them. So, and these are the type of things that people don't talk about.
Mm-hmm.
I'm calling bullshit on the lady's name being Mrs. Jones in Mexico City.
So you mentioned, Chad, that you were going to come. I'd love for you to come and call the bullshit. You'd be amazed.
All right.
You'd be amazed by the amount of patients that come and get treatment here that have the Jones attached to their last names. Yeah.
Hey, you know, it's funny. I have a bunch of patients due to the location. I had one just today that says, "Oh yeah, I need some implants. I'm gonna head down to Mexico." I'm like, "All right, I'm gonna give you this guy's name. You head on down to Mexico and tell me how much cheaper it is down there, because I guarantee you, man, they're gonna get quality care when they get a little bit more interior."
My question is this. So I know that one of the things that you like to talk about is case acceptance.
Mm-hmm.
Is that your true passion in dentistry, or what is your real passion first? And then how does that roll into what you like to teach about case acceptance in dentistry?
Mm-hmm. So, you know, I've been in practice for 32 years. And I think one of the things that I enjoy the most today is getting to know my patients and to help, and of course to help them out. And so case acceptance becomes a fundamental aspect of what we do here, or case communication. And you know, I've been teaching this seminar, the Art of Treatment Planning seminar, alongside with Frank since 2016, and Greg. Think about this. I saw Frank Spear lecturing on this topic during my residency during the late 90s. And I was blown away with how he would communicate and how he would talk about treatment planning, right? Making it so clear to us dentists. Now, the challenge is for us dentists to make it clear for patients. The end of the day is it's communicating is an art form. Hence, the seminar's name is The Art of Treatment Planning and Case Presentation. So Jeff, Chad, and JB, I love the challenge of communicating to a patient what is possible, you know? And again, it's screening Mrs. Ramirez, Perez, Gomez, or Gonzalez, or Jones, however you want to call her.
Smith.
Yeah. At the end of the day, you know, they present with, I mean, us dentists are so bad communicating. We think we're good and we suck. We suck. Why do we suck? Because we give mini dental lectures to patients. And normally our verbiage just goes above their heads. There's this thing called the curse of knowledge. I don't know if you're familiar with the term. It's a cognitive bias, very common and very well researched in the behavioral psychology world. What does it mean? It means that we assume that whoever we're talking with has the knowledge base and the background to understand what we're saying. And there's nothing further from the truth. So to me, case acceptance only happens when I understand who the patient is. I first listen to our patient, listen where they're at, listen what they're going through, and then be able to craft creatively a narrative that will resonate to them, and then start having a conversation, a discussion. And I find that absolutely fascinating, Jeff, because every time is kind of different. And so be able to teach that and to give, you know, those that come to our seminar the tools. And again, being mentored by Frank Spear, who has been the guru of treatment planning over the course of the last 30 plus years. Being able to talk about that truly is like, you know, an incredible opportunity. And I've enjoyed it so much. I'll tell you to what degree I've enjoyed talking to patients. And you guys run a beautiful podcast. And I see this is episode 171. Jack, my partner, and myself embarked on a podcast project just this year. And we're going to be filming the 50th episode, which means that we have one episode a week. And those that we interview only have one thing in common, which is they are our patients. And so the cool thing about the concept, and there's no need for yet another dental podcast for crying out loud. But what we felt needed to be done is to go through the exercise of podcasting and interviewing our patients. And the rationale was twofold. Number one, show patients that we care. Show patients that their story is important to us. Because more often than not, physicians or dentists do the talking. And the poor patient is just sitting there like listening to whatever we say. So number one, go through the exercise of truly listening to patient. And just as you guys do, go back and craft questions and enjoy the challenge of crafting questions on the go, on the fly. And because of that relationship that we have with patients and them feeling comfortably vulnerable with us, goodness gracious. I mean, we hear some stories in that podcast that are just unbelievable. So number one, the reason is we want to make sure that patients understand that dentists can listen and we know how to listen. And number two, also influence and try to influence our colleagues and invite them to listen to their patients, because when we do, the whole treatment planning becomes so much easier, because now we basically, as I said, customize the narrative based on what we hear from them. And so it becomes a really, really cool exercise, one that I enjoy doing every day. So going back to your question, what's my passion? My passion is talking to patients, getting to know them. Because guess what? We've all traveled, and I heard your amazing travel, JB, going to Amsterdam, which is my favorite city in the world.
Mm-hmm.
When COVID hit, we all stopped traveling, right? Because we just couldn't. We couldn't go to dental meetings, just couldn't travel on vacation. And I used to travel quite a bit. So for me, it was like, I felt like hand-tied initially, until it hit me. And I told my team here, and I said, listen, the world is coming every day and visiting us in the form of our patients. We just need to listen.
Mm.
Think about how lucky we are as dentists, irrespective of where we work, irrespective of the type of practice that you have. You treat 10, 15, 20 individuals a day, or I don't know how many. Everyone has a different story. And if you care to listen to their stories, oh my God, it's unreal.
And as I'm seeing this, I see what's behind you, which I've been focused on you. I read what's behind you. And I'm going to add one more thing, because I absolutely love what you say. We are very good talkers as a whole, as a profession. We are horrible listeners. Listening's number one. But the other piece of advice that I would give somebody in treatment planning and case acceptance is, don't you ever walk into a room and judge a pocketbook. You walk into a room, you educate them, you give them options, you listen. And if there's a will, there's a way. We can figure it out together, how to get you from point A to point B. Mm-hmm. And I think that we are very quick to judge. And that's just something that's ingrained in us in society. We're very quick to judge. And it's not always the case, not always the case. So,
well, and I don't know. I mean, for me personally, I don't even know if it's as much judging as I'm just really sensitive to the cost of dentistry. And so when I know what it means to treatment plan a crown, what it means to treatment plan a denture, and I know the financial burden that comes from that. To your point, Ricardo, we're trying to build that trust, which is part of that interviewing process. So
Mhm.
you interviewing your patients is building a remarkable amount of trust. Like, I don't want to say you never have to worry about it, but if you've spent an hour with a patient just having that in-depth conversation,
Mhm.
it's probably never crossing their mind again, whether or not you care about them, whether you're trying to do the best for them, whether you're just swindling them to take $1 for the next, you know what I mean? Like, you've built such connectivity that they sort of inherently give over that trust to you. And I think as dentists, we are very sensitive to the fact that trust is an earned relationship in our profession. And in exchange for that trust, there's also a monetary process that happens. And there's this weird dynamic that a lot of people are really sensitive to. They get uncomfortable discussing it. And,
Mhm.
I think you probably really impact a lot of dentists in the way that you're encouraging them to get to know their patients and talking through the treatment planning process so that they can get out of their own way almost to,
Mhm.
to get to the meat of of the reality of what patients need.
I
And
love that. I'm sorry. Please go ahead,
no, but
Ricardo.
I think JB you just hit the nail on the head, because one of the things we're not trained on is talking about money, and it's tough.
Yeah.
And when we're ready to give the patient a fee estimate, we just go like here, and we're like, they're not gonna go for 30, 40, whatever,
Mhm.
whatever amount you put. It doesn't work that way, and it shouldn't work that way. And if we don't feel comfortable doing that, I mean, giving a patient a fee estimate is the byproduct of having a much more broader conversation, one that really has to do with, I mean, dentistry can get really sophisticated, as we all know. And again, I mean, we are able to convey that message to patients. I mean, we're talking about digital. When patients walk into a room and they see your scanner, they see a laser unit, they see all sorts of fancy schmancy equipment. That right there costs an arm and a leg, right? And so we have to pay for all that. But we're not equipped to have these types of conversations with patients. And we feel bad about, and Chad said it as well. Let me just diagnose this patient's pocketbook by looking at her or him. Listen, I used to work in an office years ago, and my little office was by the window, and I would see which car the patients drove in on. And typically, I'll tell you, their complaints and concerns about the fees was commensurate with the car they drove. The fancier the car, the more they complained.
Yep. And the less they paid.
The less they paid. I'll tell you, John Coyce, who was one of our other mentors, used to tell this amazing story. So he had this lady walking into his office, and she looked she was a very simple person, and she did not come across as a very sophisticated patient. And when John asked her what did she do for a living, she said that she cleaned pizza parlors. Okay, and she goes, "I hear you're great doing veneers." And John started saying, "Yeah, we do veneers here, but they're rather pricey," alluding to what Chad just mentioned, right?
Mhm.
She goes, "Oh, you think I cannot afford you? Listen, doctor, the fact that I told you that I clean pizza parlors does not mean that I have not been saving all my life to get the teeth that I want. Now, if you don't want to treat me, that's fine. But don't you judge my ability to pay based on what I do." So to both of your points, I mean, what we do has a price tag, and we just don't go like this.
Mhm.
Let's see where the wind is blowing and how much I'm going to charge you. I mean, whatever it is, the fee that you came up with is the fee that you charge, right? And if patients appreciate what you bring to the table, who you are, who your staff is, the experience you create, and that's the other thing that we talk about during this seminar, then having those conversations, JB, is way simpler than we think they are. But a lot of it has to do with the story that we tell ourselves. Oh my
Mhm.
God, they won't be able to afford it. Oh my God, it's a burden for them. We shouldn't be deciding for them, right?
Yeah.
Well, guys, we are over time. I could actually, Ricardo, talk with you
Yeah.
for
Keep
hours
going.
because I so appreciate your passion for what we do and your passion to know people. I will say that the day we started putting new patients in for an hour only on the doctor side was the day our case acceptance went to a different level, because you cannot understand a patient in a 10-minute visit in the hygiene room. It cannot happen. And they know it, they feel it, and it doesn't matter how thorough or smart you are, they just will never feel as comfortable as when you take the time to get to know them. But really quickly, if you don't mind, just tell us, well, first of all, Spear Education has offered $200, I believe, JB,
Yep.
off of any course. So,
There's
um, I,
seminars, I
yeah.
think, on the art of treatment planning.
Oh, on the art of treatment planning, which obviously, if you've heard Ricardo today, this is something that you want to take. I want to sit in this course as well. So we may be sitting with you when you go. But I just want to say thank you, Ricardo, for coming and joining us and taking your time to do this. We so appreciate your passion. And we so appreciate what Spear Education is doing. And with that, are there any things that you would like to add, or if people have specific questions, where should they be directed?
Okay. Thank you. Well, so going back to the seminar, this is a seminar that I said I teach with both Greg Kinzer and Jeff Rouse, who stepped into Frank's shoes, and he's doing amazing. Jeff just brings to the table so much wealth of knowledge, is unbelievable. As far as getting a hold of me, my social media handle of choice is Instagram. I'm pretty active, so if you want to check out my account, it's Ricardo Mitrani is my last name. And would happy to entertain any type of question. And finally, just congratulate all three of you. Listen, as I said, we are doing this podcast for the last year, and it's Jack and myself, and so I'm very sensitive about the energy that hosts in a podcast can create, and you three do an incredible job. It makes the guest feel very comfortable, and it's not the guest. I feel that the audience can sit with us very comfortably because of how you create this energy and this space. It's a safe space. It's a fun space. So kudos to all three of you. I mean, it's amazing. I can't wait to see more episodes and see you guys interacting with other people. This has been a lot of fun, and I want to thank you all for having me. It's been amazing.
Honor is ours, without a doubt.
Yeah. So, yeah, I'm going to close with a story tonight, which is something that I rarely do, but it relates to what we were talking about. And I actually witnessed this firsthand. We're going to go back to, I think it was 2016, 2017. We're sitting in the Cadillac dealership in Arlington, Texas. And we were in with a salesman in one of the rooms that's surrounded by glass. There's another salesman next to us surrounded by glass. And there's people behind the desk and in front of the desk. And this old man drives up to the dealership, and he's driving like a 1984 Oldsmobile that's beat to hell. This elderly guy gets out of his car. He walks into the dealership, and he walks up to the glass. As I'm sitting in the room, he knocks on the glass next to me, and he says, "Excuse me." And the guy's like, just a minute. And he's like, "I'm so sorry," to the person that he's with. And he bangs on the window again. He says, "Excuse me." He says, "How much is that black one in the parking lot?" And he says, "Which one?" And the guy gets really frustrated. He tells the person, he says, "Excuse me." And he goes, "The big black one right in front. It's this Escalade." And the salesman says, $78,000. The guy goes, "Okay." And he leaves. And the guy says, "I'm sorry," once again. And we're kind of like distracted. We're watching this. So the old gentleman leaves. And he walks away from the dealership, and he leaves his car in the parking lot. We're continuing our deal. The people next door are continuing their deal. About 5 minutes later, the older gentleman walks back, and he slams a check for $78,000 up against the window and he says, "I want it." The salesman drops what he's doing and gets up, yet the salesman sitting in the lobby that was willing to listen to this guy grabs him and got the sale. And so to me, it's a matter of judging. It's a matter of listening. And the sign on Ricardo's wall says, "The world is giving you answers each day. Learn to listen." And I am just such an advocate of listening. I think that if you have the time, you need to go to the treatment planning and case acceptance. You learn so much about yourself. You learn so much about proper treatment planning, proper case acceptance. But it seems to me we're going to learn a lot about listening. And I think that's really important. It's not just the talking, it's the listening. So thank you again, everybody, for listening to us, not just hearing us, but listening to us. And we'll see you all next week.
Have a great night.
Bye, everyone.
Everybody.
Thank you.
Hey, Dinks, it's JB here. Thanks so much for listening to Dr. Ricardo Mitrani on today's Hump Day Happy Hour. Today's episode was brought to you by Spirit Education. And for our listeners, they're offering $200 off of their seminar, The Art of Treatment Planning and Case Acceptance. That brings a significant decrease in the cost to enjoy this amazing continuing education opportunity through Spirit Education. So if you want to take advantage of it, the link will be accessible to you in the description of the podcast. Click, register, and hopefully you'll see a few of us Dinks roaming around the campus in 2024. Thanks for listening.
And that wraps up another podcast for Dentists in the Know. On behalf of Dr. Jennifer Bell, Dr. Chad Duplantis, and myself, remember that we've got a great profession, so let's make it a great day, Dinks.